Welcome to Baptist Medical News. I'm Rhonda McRae. Thank you for joining us today for our live seminar. Our guest today is Dr. Amanda Nichols. Thank you for joining us today.
You're welcome. Happy to be here.
Thank you. She is an OB-GYN, and she is our expert and going to help us with the first OB-GYN visit, how to choose an OB-GYN, and what to expect. So thank you for doing that. At what age or at what point should a young girl first see the OB-GYN?
Well, it's an individualized answer. The American College of Obstetrics and Gynecology recommends that young girls start seeing a gynecologist initially between the ages of 13 and 15. I don't absolutely think that's necessary for everyone, and I think most OB-GYNs would agree with me. And actually, some obstetrician gynecologists actually have an age limit where they won't see patients or don't see patients under the age of 17 or 18. I feel if you're having a problem between the ages of 13 and 15, you definitely need to come in and let us take a look and see if we can solve your problem.
When you say a problem, do you mean like a menstrual problem?
I do. Usually? I mean a menstrual problem as in irregular periods, very painful periods, or really anything else that you would be concerned about. But most people, I think, feel that the appropriate time to really come to the gynecologist is around age 18. Okay. You know, women who are sexually active or girls who are sexually active, they need to come in whenever that occurs, or even if they're thinking about having intercourse. You don't always have to have necessarily a pelvic exam or a pap smear when you come to the gynecologist. The new recommendations for pap smears are 3 years after you become sexually active or age 21, whichever comes first. Okay. However, many insurances will pay for pap smears before that time, so if you wanted to get a pap smear really around the age of 18, it would be appropriate.
Okay, all right, so 18, unless there's some sort of menstrual
problem,
issue
and then sooner.
But in general, at age 18, so if you're 18 and you haven't had your first appointment, you're watching the right webcast. All right, so Dr. Nichols, choosing an OB-GYN, what should someone look for?
That can be difficult for people if you don't know one specifically. One way that you can find an OB-GYN is just ask your family doctor, ask your pediatrician who they would recommend. Most of them have someone in mind that they generally refer to. Also ask your friends and family members, ask them who they go to, ask them, do they like their OB-GYN? Does their OB-GYN listen to all their concerns, address all their problems? Do they have a good bedside manner? And really word of mouth is a great way to find a doctor.
Okay. What about certifications or board certifications, credentials? Do you think that's all covered in asking family and friends, or is that something to be concerned about?
It is, and most of the time you can find that information online. For example, my clinic, the Women's Clinic, we have a website, www.twc-ms.com. You can go onto our website, and we have photographs and profiles of all of our physicians, and you can go through our profiles, and that could be a helpful resource to find a physician.
Right, so ask friends and go online to
That's right.
kind of follow up on what you learned. That's a great idea.
Mm-hmm.
All right, so they've made the appointment. They're coming for the first visit. How do you want to do this? You want to start from the time they check in?
Mm-hmm.
Okay, well, let's go that way.
Yeah.
So here's what to expect on your first OB-GYN visit.
Well, when you come to the doctor, really any physician's office, what you need to bring with you is, number one, your identification and also your insurance card, because they're going to ask for that when you check in. At our particular office, when you check in, you'll be given an information sheet, and you'll be asked to fill out all of your medical history, surgical history, and you'll be asked to describe any problems that you're having. Once the information sheet is complete, then you'll go to the lab, where we generally get a urine specimen, check your height and weight, and generally blood pressure. Sometimes we do a finger prick and check the hemoglobin level also. And then after the lab is complete, then you'll go to an examination room or the physician's office, and the physician will go over your history form with you. And what we're going to ask, or what we're going to look at on the form and what we're going to talk to you about is basically, what is your past medical history? Do you have any medical problems? Have you ever had surgery before? If so, what type? We're going to want to know, what's your social history? Do you smoke? Do you drink alcohol? Any recreational drugs? Are you an exerciser? Do you take calcium? What is your occupation? Are you a student? Just find out a little bit about you. We'll also want to know your obstetrical history, if you have an obstetrical history. Have you ever had a pregnancy before? Tell us about your prior deliveries. Have you ever had a miscarriage or an ectopic pregnancy? We'll also want to know about your gynecologic history. When was your last menstrual period? Are your periods regular? Are they normal? Is the flow normal? Are they particularly painful? Do you have pelvic pain with your periods or during the month? Do you have any history of gynecologic problems like endometriosis, ovarian cysts, fibroids, any urinary issues? We'll go over all those questions. We'll also want to know if you're sexually active, and if so, what kind of birth control method do you use? How many partners have you had? Those are important questions as well. And then we'll ask you if you have any complaints or any problems that we didn't cover that you want to go over. After we take a history, then we do generally a physical exam, and the physical exam that we do really depends on what we get out of the history. If you're not having any problems and we need to just do an annual exam, generally we do a pelvic exam, a breast exam, and then just a brief general physical exam. If you're having any problems, pelvic pain, history of ovarian cysts, anything like that, you may require an ultrasound or some further testing. But the physical exam generally includes a pelvic exam, possibly a pap smear, and then generally a breast exam also.
Okay.
And then after the physical exam is done, we'll go over any problems that you might have, the physical exam findings that we found during your exam, and then we'll come up with a treatment plan and discuss if you do need any treatment or medication, we'll discuss it at that time.
Okay. All right, so do you find that during that sort of conversation with the doctor and when you're getting the medical history, do you find that that might be a time when someone who's never been to the doctor before, it's an opportunity to help them get a little more at ease, make them feel a little more comfortable?
Absolutely, absolutely. And generally for initial patients, I take those women into my office rather than talking to them in the exam room. And I always talk to my patients before they get undressed because I really feel like that makes them a little bit more comfortable.
Right. Yeah. Good plan. I think right now, Dr. Nichols, we've kind of covered just the basics. So before we get into any other sort of specific questions, I think I'm going to pause now and see if we have any questions from any viewer. So excuse me one second. I'm going to refresh this screen and get to that right now.